Check out the latest highlights from the Nourishing You podcast.
So talk to us about the main symptoms you see associated with these type of disorders.
Sure. I mean, some of the symptoms of depression and anxiety are symptoms that you and I might have every day, but when they're kind of collected and impair functioning. So for depression, it would be, a chronically sad mood, feelings of hopelessness and helplessness, and then often physical symptoms like a poor sleep, and oftentimes either a decrease or increase in appetite. But the overwhelming kind of emotion is this feeling of unrelented sadness and hopelessness.
Okay. I was just going to, sorry to interrupt. Yeah. I was just going to ask real quick. So, and when you say chronic, what time period, what time period might be okay to feel sad when something's going on in your life? And then at what point does that become chronic?
Yeah, and that's going to vary from individual, and too many individuals are just used to feeling sad and they don't understand that they've been struggling with depression because they think that's what their life is like. But I think if someone has a stress or a trauma or a loss, it is certainly appropriate to feel sad and to grieve, and that could be weeks or months. But if the level of depression and despair starts to affect your physical health, like sleep and appetite, and it persists for weeks or months, then it's time to address and get some help, at least begin to talk to somebody.
If you enjoyed this short episode, check out our full library on our NAMP YouTube channel, where you can catch up or learn more. Keep in mind that the information on the NAMP podcast is for educational purposes only and should not be considered medical or legal advice. The NAMP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NAMP and all agents. Copyright NAMP, all rights reserved.